Happening right now, figuring out who should get a COVID-19 booster shot if the FDA gives the green light.
The News4JAX consumer investigator Lauren Verno is joining us now. Lauren, pretty unusual that the CDC would be meeting right now without first getting that FDA approval.
Yeah, for a lot of people, they don't know this process, but it's very unusual because shots can't go into arms until the FDA first gives the approval, and then the CDC recommends who should get the shot. Last week, an FDA advisory panel overwhelmingly did not recommend the booster shot to anyone 16 to 64, but only for people 65 and older. But again, it was only a recommendation and not a final ruling from the FDA. COVID-19 booster shots are at a standstill until the FDA makes a decision. But the CDC's Advisory Committee has decided to go on as business as usual. And what will be a 2-day-long meeting starting today, the CDC's Advisory Committee on Immunization Practices will make a recommendation based on data presented during this meeting as to who should receive a COVID-19 booster shot.
It's messy, it's ugly, but that's because there's scientific uncertainty. And when there's scientific uncertainty, we want to hear from all sides.
Meanwhile, many international agencies like the World Health Organization have asked for richer countries like the U.S. to not approve booster shots until the end of the year and make more doses available for poorer countries. President Biden answering part of that request today.
I made and I'm keeping the promise that America will become the arsenal of vaccines.
At the Global Vaccination Summit today, the president announced the U.S. is doubling its purchase of Pfizer's vaccine with the promise of donating a total of 1.1 billion doses within the next year, which would vaccinate 70% of the global population.
For every one shot we've administered to date in America, we have now committed to do 3 shots to the rest of the world.
All while the White House maintains there is enough supply ready to go if the FDA approves boosters for Americans. Now, there is a chance the FDA could approve boosters today, tomorrow, by this week, which means the CDC would make its recommendations and boosters could start the next day. But right now, we're essentially in a limbo until the FDA makes its final announcement. Kent?
Yeah, so, Lauren, what are the concerns with the FDA waiting this long to decide?
So there's a few of them, but the biggest concern is that people are taking these boosters into their own hands, going to pharmacies, getting the shots, potentially lying, saying it's their first dose, which then messes up the data being collected on how many people are vaccinated. So those numbers, we know how important they are. So really getting it out there. Do not go there and say it's your first dose if it really is your third.